So when are situations when I tell patients, no, we shouldn't be doing a facelift? So as a doctor, as a double board certified facial plastic surgeon, my number one goal is to first do no harm. So I want to make sure that we're doing elective cosmetic surgery in the safest situation possible. So if you are a current nicotine user, whether you smoke, vape, chew, dip, all of the things, I've done posts on this before, those are things that can affect the overall healing or the results of your facelift surgery. So that's something where I'm going to decline that patient till they can be nicotine free for at least 3 to 6 months, and we do nicotine testing in that process. If your BMI is over 30, that's something where it can make it unsafe to do surgery in an outpatient surgery center. If you are in the process of losing weight, I recommend that we just delay surgery till you're within 10 to 15 pounds of your goal weight, so we have a better idea of what procedures need to be done. Other things. If you have uncontrolled medical conditions, if there are situations where you have really high blood pressure and you're not on a medication regimen where you're able to be stable, if you require chronic long-term blood thinning medications, that's something where it can make it unsafe to be doing surgery. The other thing to talk about is, are you going to get enough correction? Is the juice worth the squeeze, is the example that I like to give. So I have some of my younger patients who will come in who are thinking about almost like preventative surgery. And I don't find that doing facelift surgery is good to prevent aging. It's something where there needs to be a certain level of correction. And if there's not going to be enough correction, I'm going to ask you to delay surgery, come back in a couple years, stick with your good medical grade skincare, stick with your Botox, stick with your sunscreen, eating healthy, all of those things. And then we can chat about it again in 5 to 10 years. The other thing to talk about is unrealistic expectations. If when the patient and I have conversations about the level of correction that we're going to get, in my hands, if I don't think I can deliver the results that they want, that's going to be a situation in which I decline operating on that patient. Another thing to think about is if the patient's rude to my staff. There are situations where I can have patients that are extremely demanding, rude, unkind, situations where my staff feel uncomfortable. And yes, I'm your surgeon, but it takes a whole team of us to take care of you. And so I have operating room staff, I have front desk staff, I have people who coordinate your pre-op and your post-operative care, and we all work together as a team. And if it's something where the patients are not able to vibe well with the whole office staff, it's a time where they probably need to just find another surgeon.